Welcome back to ScreenMe's podcast. Today, I have the pleasure of welcoming Inna Duckworth to the show. Inna is a reproductive microbiome expert who's dedicated herself to lifelong learning and the practice of natural holistic medicine to provide her patients with effective solutions that really address the root cause of fertility issues. And today, in particular, we're going to be delving into the uterine microbiome, which I'm very much looking forward to. So, thank you, Inna, for joining us today. And to start, could you tell our listeners a little bit about yourself and your background, please?
Um, I have realized that I wanted to be doing some work in natural health quite early, but it took me some time to fully transition to this practice. I've started my training somewhere around 2003. In 2010, I officially moved to the UK to do the course in initially in herbal medicine, and then it took on. And now I am a nutritional therapist, a medical herbalist. I'm trained in various modalities, including 5-element and some other Eastern and Western modalities. So literally, it is a lifelong learning and service to this medicine. I came to microbiome by chance, if you like, because I was looking into the symptoms that I didn't work with fertility then. I was working with women going into perimenopause, which is understood to be something like 35 plus, where women's hormones start changing, but not in the way that we were described when the menopause is actually coming. It's a very different story in terms of what's happening. And this period is the most active in the life of women, like 35 plus, sort of. You've done the training, you've done anything you wanted, and you sort of get to the peak of your performance, and you start getting weird symptoms, including vaginal and urinary. And I started looking, I did some training in this area, and I kept training. And this area never really left me because it's such a dynamic, so developing. It takes us to many directions. It's not just microbiome. Microbiome does not live in isolation. It's symbiotic relationships between us as hosts and microbes that inhabit us. And a little bit more now is understood about the gut microbiome. When we say about gut microbiome is affecting our mood, for example,
Mm.
but we don't talk about vaginal microbiome affecting our mood, which can also be the case, which is still in next chapter for people to discover. That's probably all I can say about me.
Yeah, no, definitely. I think it's such an interesting field. And as you mentioned, there's so much more research to be done and ever more coming out. So I think that's, yeah, really, really interesting. And maybe just a brief overview, I guess. I'd love for you to give me a brief overview of the value of microbiome testing for fertility, for example, or reproductive health in general.
Yeah, I think that's really essential. If you just think about it's just topical. If we talk about this sort of let's call it reproductive microbiome, because
Yeah.
as we develop, we will find out some other ways. For example, maybe we'll find out ways to measure like ovarian microbiome,
Hmm.
or even more. So let's call it reproductive. This is primary point of contact with the oocytes and spermatozoa, and not knowing what environment they are developing in can be detrimental. And here I would like also to make a bridge between microbiome and conditions like endometriosis, conditions like polycystic ovaries, and or the more developed area of reproductive immunology. If somebody has got elevated natural killer cells, so they are trying to kill something. We can think that it's some kind of memory cells that have killed something and didn't calm down. But in many cases, they're still trying to kill something. And initially, if you say, I don't know about, let's be very polite, about 10 years ago, if you tell somebody that, well, there is bladder microbiome, majority of big professors will laugh you out of the room. They'll say, oh, no, no, the bladder is sterile, the urine is sterile. We know it isn't. And that's why ScreenMe's got a new product as well, which is a urine microbiome.
Hmm.
Knowing the very short answer is we need to know the terrain, we need to know what's going on, and we need to address it.
Yeah.
Because if somebody comes to see me and they haven't done vaginal microbiome or uterine microbiome, which we'll discuss in a minute, I really literally don't know what is going on. I do not know what can I do for you.
Yeah.
Because I think that the terms like, oh, I've got a thrush or I've got a BV should be like gently kind of replaced with actual understanding what is going on. And as you know, I review test results for ScreenMe. I've seen just this year, I've seen over 200 results. And I'm yet to see a there's never just Candida, very rarely. I can remember 3 cases where it was just Candida and
Mm.
everyone else had something else. And
Yeah.
ScreenMe was probably the first one to allow people to actually see what is going on. And
Yeah.
I'll come to that because I was saying, well, maybe I'll just talk about that, why I like ScreenMe and why I believe ScreenMe is a really advanced company in that way. Every other company has got some filter on providing data.
Mm.
It's almost like data policing, if you like.
Mm.
What ScreenMe provides you with all the results, and it helps the professional to understand what is going on. And why do I disagree with some offers of algorithm? Well, the algorithms can get outdated, and they also don't give you historic data. For
Mm.
example, we are just starting to understand, well, there has been works for maybe the last 10 years, but there's always a bulk of research and there's a step change where the more wider medical community,
Yeah.
says, oh yeah, it's actually happening. Oh, that's actually important. So for
Mm.
example, we are getting more like a wider context understanding of environmental biotoxins.
Mhm.
And say, for example, in 5 years' time, there's more understanding about that as well. And somebody chooses to test and understand all that. Well, somebody does, for example, a ScreenMe test, and they see something very weird that we think is weird now. In 5 years' time, people will say, "Oh, yeah, we understand that," and
Mm.
they will not be able to trace back
Yeah.
because the test results from other companies didn't provide them with the data. Where with ScreenMe, you can look back as long as you've tested and say, well, actually, this was a problem then.
Yeah.
And it helps you to understand how embedded this problem in this person.
Mhm.
So I'm absolutely saluting ScreenMe for the openness. Yes, I know I see a lot of practitioners as well for ScreenMe, and some of them tell me, oh, it's harder maybe to interpret the test results. Well, this is where you start educating yourself. You start building up some libraries and understanding what this bacteria does. But not having this data, in my opinion, is detrimental. That's why ScreenMe is my choice in that way.
Yeah, no, thank you. I think the key point there, which you've explained really beautifully, is this gender health gap, almost this gap in knowledge, whereby people are either designated as having thrush, BV, or don't know. And as you mentioned, the role of all these different types of bacteria. I mean, yeah, we use a huge database at ScreenMe. The role of all these different bacteria and their composition and how they interplay together, I think, is something that we need to educate ourselves on. And that is part and parcel of closing that gender health gap. And I think that's where the microbiome is really interesting. And there's so much space, as you mentioned, how it's implicated in all different systems, including immunity, including other conditions, fertility just being one of them. So I think, yeah, that really explained it. Thank you very much for that. And I think,
Here and fungus as well,
yeah, of
because
course.
what the library that ScreenMe uses is probably the largest in the world that includes fungus. For
Yeah.
example, the next possible opportunity to retest, like for example, they do not show they don't have fungus library
Mm.
as ScreenMe, and you just don't see. And for example, we are still learning the impact of different fungus on
Yeah.
humans.
Mhm.
When especially we find mold-related fungus species, at the moment, we still learning whether they are, what role they play in
Mhm.
well, we know that mold is detrimental for fertility context. And right in the morning, the first paper I read that alpha toxin, one of the key mold toxins,
Mm.
is affecting neurodevelopment, is linked with autism. So you don't want somebody trying to get pregnant if they have been exposed to mold, but it's very hard to test for mold because
Yeah.
there's no like, so in this sense, like for example, microbiome screening like this helps us to open the gates. And this is also an amazing bonus. And mold is just an example. I'm sure in 10 years' time, quite often I see in the results some environmental yeasts, and
Yeah.
we don't know what is the impact yet, and we're yet to learn, but we can warn somebody saying, look, this is what's happening, this is how you can deal with it, or for me, sometimes this is enough to say, look, you need to get a better diet.
Yeah. A
Better
hundred
diet,
percent.
that's what's happening.
Yeah, 100%. And maybe for those who may not be completely up to date on the differences between tests, ScreenMe uses NGS, so we screen
Yeah,
over 100,000 types of bacteria, whereas with other tests like swab or PCR, they'll choose 20 or so
yeah,
select
yeah,
bacteria and tell you whether that's present or not. So
yeah,
what Ian is kind of explaining here is how there's so many different types of bacteria, yeast, fungi, mold, as you mentioned, that can all play a different role that we have yet to even fully understand in the health sector itself. And so I think as more and more research comes out, this kind of data is going to be more and more interesting and also beneficial for
yeah,
improving your intimate and reproductive health. So yeah, I think that's really important to note as well. And I think diving into the uterine microbiome in general, I'd love to know maybe a brief overview of what the uterine microbiome is for those who perhaps haven't heard of it and why doing this testing can be important.
mhm. So this is primarily targeted for people who are trying to conceive, so
Hmm.
fertility, especially if you've had a pregnancy loss, unexplained pregnancy loss, or if you've got recurrent implantation failure, whether in natural cycle or assisted reproduction.
Hmm.
Uh, so uterine or endometrial microbiome, as you can think about it, is actual lining of the uterus that allows for the embryo to implant and grow. And so what we found out that sometimes there are discrepancies between the vaginal microbiome and uterine microbiome. And for these instances, uterine microbiome is recommended over vaginal microbiome because it's more important, really. How I would differentiate, first of all, I strongly recommend you finding a practitioner who can help you with understanding the details and what is needed to be tested and when it's better tested. So the uterine microbiome that ScreenMe offers is a first menstrual blood that you need to collect in a specific way. It's not a difficult collection. It's all done at home, but you just need to have your kit up in advance. So if you think that you need to test for that, then just get the kit in advance because you literally need the first blood. Why do you need the first blood? Because we're trying to sort of the gates open and the first blood comes out and that the gates, but the menstruation initiated and you get the first blood that comes through the cervix and comes through the vagina and you collect it. And by this, we are looking at a proxy uterine microbiome. Yes, the gold standard for uterine microbiome is a biopsy. Here, I would like to say for health professionals and the clinics that you can do the uterine, you can request a kit from ScreenMe and do a biopsy, uterine microbiome via biopsy. But it's very disruptive. It needs to be sedated. So using the like this option that ScreenMe has developed is a much more approachable way, and it's amazing for retests as well, because what one must say that some of the bacteria are notoriously hard to clear with antibiotics and with antibiotics alone. So you might want to, some people, it depends on several parameters, which probably shouldn't delve here, but I'll say several of them. One is, first of all, it's a biofilm. And second, there's two components, two genetic components. One is linked with clotting mechanisms, which help creating or non-creating biofilm. And second is second genetic component is about clearing the microbes, clearing the debris, detox. So in those two instances, you've just tested for something, you've detected something, you had an antibiotics, and then you think you're done. You might not be done. You need to retest. And now, if you happen to have a uterine biopsy, retesting another biopsy every cycle, first of all, it's not just money. It's a very difficult procedure. So using ScreenMe as a retest is an amazing option to get you to the point when you are more or less in the clear. And also, like I must strengthen out here that there's only few other options which are available at the moment, but they do not give you full disclosure of the bacteria. Just yesterday, I've reviewed test results for somebody where some other test came back, oh, there's nothing to see here. But we know from ScreenMe test results that this person is in a 5% of women who are bifidobacterium dominant rather than lactobacterium dominant. Now, bifidobacteria are similarly beneficial bacteria. They're just less researched and maybe they're less protective. And we starting to understand there's a massive genetic component that women of non-white genetic background, they happen to have a higher incidence of bifidobacterium dominance. So by doing other tests, you do not know what you're looking for. So the test results came back as you've got 0 lactobacteria, oh, you are in trouble. But we know that this person has had in her previous ScreenMe results, she's got over 90% of bifidobacteria.
Yeah.
So that the validity of this super expensive, super traumatic test where you have to get sedated, go to the doctor on a specific day in the cycle, the validity of this is slightly questionable. There are some valid points, but it's not the full information is not collected. And
Yeah.
that's why ScreenMe works better in that way. Now, if you're thinking, oh, vaginal microbiome and uterine microbiome, how do I differentiate? Well, if you just started working in fertility with your client or yourself, and you've got symptoms, you're symptomatic, collect the sample at the most symptomatic day possible. For some women, that will be straight after period. That will be one set of bacteria. Or for some women, it will be around ovulation. For some women, it will be in the mid-luteal phase. And for some women, it will be at just before the period. Know when you are the most symptomatic. If you're most symptomatic after an intercourse, wait for 24 hours and test. You will see because and this links us to semen microbiome, which ScreenMe also offers. It's a very different story. Call me to talk about that. So you do the vaginal microbiome testing. You deal with that, and then you see what's happening, retest and see what's happening. And if you think there's still some problems, then you would go for uterine microbiome. However, if you come already with history of losses, unhappiness, and you're largely asymptomatic, go straight to uterine microbiome.
I think that's really useful for people who perhaps maybe wouldn't know whether to use them in conjunction with each other or to use them
You
separately.
can use them in conjunction with each other too. It's just sometimes you need to think about the finance allocation and
Yeah,
stuff, because
no,
it all depends. It absolutely depends. If you are symptomatic and you had losses, you might want to do both. You might want to test the uterine microbiome first, menstrual blood, and then you might want to test the vaginal microbiome again at the height of the symptoms.
Yeah, no, completely. And I also think it's really useful, just to clarify, as you mentioned, traditional methods of biopsy are often invasive, whereas this ScreenMe uterine microbiome test is a non-invasive alternative that can provide you valuable context, as you kind of mentioned, the differences between the biopsy and the ScreenMe test. And I'd love to know a little bit more about how the uterine microbiome, like why it's important in particular and how it can impact fertility in particular or other reproductive health.
Uterine microbiome, well, that's the exact, if your house is dirty, it kind of, but it's much harder it's just that we're talking about the environment, the actual environment where the embryo will be growing. And again, based on the microbes found, we can make some connections with, for example, endometriosis, and for example, polycystic ovaries, and for example, estrogen imbalance and or androgen imbalance. We can still not only we can help you clear, like not only we can give you information, and then your route to clear that will be ideal scenario if you need antibiotics, you'll have a medical professional. If you need support with balancing microbiome, like with probiotics and maybe
Yeah.
some of the other nutrients, you can see a health professional like myself or my colleagues. So it's a complex work, but the key point is the environment. Very often the amount of so if you have got imbalanced microbiome, say you've got things like strep B,
Yeah.
and then strep B is known to be detrimental for fertility. It's known to be linked with pregnancy loss. And if you've got strep B, not only in your, so say you had strep B detected in your vaginal space, and you've got a competent cervix. A
Yeah.
lot of medical professionals will say, well, it's okay, we will just retest you about 20 weeks and give you antibiotics and you're good to go.
Mm.
Um, as much as it's not my approach, but this approach exists, but because of cervical competence, it is assumed that this strep B doesn't go to the uterus.
Mm.
Whereas if the child is growing, or if the fetus is growing in the strep B situation, it can cause pregnancy loss. I mean, and it depends also. Uh, Pregnancy is a long journey in terms of 9 months. You can get unwell, you can get a cold, you can get something else. And when you've got already imbalanced microbiome, that's much harder for the body to deal with,
Yeah.
especially for things like strep, because streptococcus is the infection we get when we get cold, like a cold, for
Yeah.
example, carry it on our hands. And so that's one scenario. For example, if you had ureaplasma in your uterine microbiome, that is a known producer of inflammatory cytokines.
Hmm.
You might just have an unexplained recurrent implantation failure. Just because, and people will say, well, it's nothing to see here. And again, ScreenMe is amazing in that because you show everything. You show when ureaplasma is not 0.1%, but
Yeah.
it means that there's still some activity there.
Mm.
And it maybe not necessarily, the clinical decision obviously depend on the clinics that you're working with, the practitioners you're working with, but at least understanding that you might be a carrier of ureaplasma, you might still need to do something about it.
Yeah.
I think for many people, the first thing I hear when I see a couple for the first time often is frustration that they didn't have any explanations.
Mm.
There was
Yeah,
no,
completely.
there was no tests, there was nothing offered to see
Mm.
what was actually going on. So yes, I'm a huge advocate of tests in principle and good tests, clever tests like ScreenMe in particular.
Yeah, completely. And I think, yeah, as we've kind of already covered as well, I think the value in choosing the right test for you, as you mentioned, ScreenMe does 100 screens 100% of the bacteria
And
and
fungi.
species present
And
and
fungi.
fungi.
Yeah.
Yeah. Whereas like if you have another test that only provides a partial lens of the
Yeah.
situation that's going on, it might only screen 20 or so bacteria and just say whether they're present as opposed to how much they're there or to
Yeah.
what extent they're dominating. So I think that's really important when you're investigating these tests that may perhaps label themselves as microbiome tests, but are actually just
But it's
looking
just
at
different levels.
yeah.
When it's not like if somebody is not trying to get pregnant, they might choose some other test. But
Mm.
for pregnancy, well, first of all, they'll still get incomplete results, but it's less crucial
Yeah.
than it for pregnancy because you count each month, each cycle counts.
Yeah.
Um, yes, I wanted also to say that because the ScreenMe does not discriminate, nobody filters your results. You
Mm.
know, like this is something like somebody chooses to cut off at a certain percent, or
Yeah.
these bacteria do not matter. Well, how do you know that they do not matter? I mean, and this particular person in this particular situation, they do matter.
Yeah.
Might be
No,
more important. Yeah.
completely. I think that's really useful. And I think also highlighting some of the ways in which the uterine microbiome is important was really useful. So thank you for that. And I'd love to know a little bit about, obviously, it's very individualized depending on people's results, but what are perhaps some of the practicalities or interventions that you end up suggesting or may suggest for uterine microbiome, just so people get an indication of the pathways that you can kind of take?
What the practicalities first is read well the instructions that ScreenMe provides how to do that. because it's important to get, as I say, that the first blood is important because we
Yeah.
don't want contamination with like, we just don't want contamination. We want the first blood. That's first an important practicality. In terms of interventions, well, I think that having a really good team of like a supportive doctor, not dismissive doctor who
Yeah.
will listen to you is really important. And ScreenMe works with many clinics, and if you email the office, you might suggest some clinics that are more open to this work than others. Then don't stop at antibiotics. Antibiotics on its own, it's a known problem. I'm not opening like some kind of esoteric knowledge here. It is a known problem that we've got a multi-drug resistance,
Yeah.
and the doctors are just opening their books to to understanding of biofilm work and understanding how to work with different microbes. And then when you give an antibiotic, even some broad spectrum antibiotics do not work efficiently first time of asking for many reasons, because we've got different, as I already explained, different reaction to them.
Yeah.
So don't stop. Also, every time I hear, oh, we just had a round of antibiotics. Did you do anything else? No, we didn't. For me, this is like, no, you have to look for a fertility trained specialist who
Yeah.
can help you with that. And the other point where ScreenMe is amazing with this new offer is retest. Do not assume. We
Mm.
just did it. Do not assume.
Yeah.
So yeah, that's the practicalities.
Yeah, that's really interesting. And I think, yeah, really important for people to know, as you mentioned, that kind of reintroduction of the good bacteria is just as important as getting rid of the problems that are there as well. And what kind of, yeah, other interventions do you perhaps suggest to kind of, what are some of the ways people you often recommend reintroducing this good bacteria, for example?
So yes, there are some types of probiotics that are better researched for
Yeah.
female health. So I would recommend those probiotics very individually, usually, or very, very individually in
Yeah.
terms of how much, how frequent, how long for, and again, retest. I'm not, um, don't put more on yourself. Retest. You need to know. We've got cases where, for example, there's an understanding that somebody may have a community state type 4, which is where the slightly unfortunate situation where it's just assumed that the good bacteria, the normal state is a non-lactobacteria, mainly Gardnerella and other stuff.
Yeah.
So, but we never know what will happen if you introduce a lot of lactobacteria. And in some cases, this shifts from Gardnerella to lactobacteria, and sometimes it shifts enough to get pregnant.
Yeah.
In some cases, it doesn't shift at all. And then there's other clinical decisions that are discussed with your primary care provider, your fertility consultant. But this understanding is important, and it's important to retest as well. In terms of interventions, first of all, I work with various kind of constructs of biofilm breaking based on the microbes found, and I have spent some good time learning how to work with that. And I share this information often with the practitioners because it's not something that you just explain to the
Mm.
client. It needs a practitioner to be able to pick up this information from you and monitor the
Yeah.
progress of the client. So I work with biofilm breakers because I'm trained as a medical herbalist, which is a very rare profession in this country. And so I can blend the herbal blend, which will be addressing the kind of not only the sort of microbes, but the environment as well. And then some professional quality supplements, again, working on immune support and like vitamin D, for example,
Mm.
zinc, vitamin C, and all of that is to help shift the terrain from being inflammatory and being favorable to this bacteria that we don't want to have, to
Yeah.
be more favorable to the bacteria like lactobacteria that we believe is a gold standard for the microbiome, both uterine and vaginal.
Yeah, that's so interesting. And as you said, it's such an interesting and complex field and highly individualized depending on what bacteria you get. So it's I guess, impossible to kind of give a one size fits all almost approach. But I think that's some of the beauty of the microbiome work, is that you can really target those, your specific case, and really work towards your goals that way, which I think is really, yeah, really useful for people to know. And I think that brings me to the end of my questions. And I just wanted to know, is there anything else that you wanted to mention or anything else that you wanted to say?
Well, yeah, I think thank you very much for this interview. It's a pleasure. I'd like to say, do not, what I would say that if you are starting working, if you just starting trying to conceive,
Mm,
thinking about it,
yeah,
do a vaginal microbiome test. Just run a vaginal microbiome test. And if it's something unhappy, we will talk to you about it on
yeah,
the calls. Don't like this advice of, oh, just do something for 10 for 6 months to a year and then see how you're doing. In my opinion, it's just grabbing this year. But if you do a microbiome test, and it can be the gateway to understanding, well, because so many times I've seen that it's massive, for example, ureaplasma with Gardnerella.
yeah,
Um, Even if you get pregnant, it's arguable, but this inflammatory terrain may be affecting your pregnancy. And why? Why? If you can make some
yeah,
rather like,
completely.
not so difficult interventions
Yeah.
and just prevent all of that.
Completely, as you said, I think that so often we kind of forget about vaginal health when we're actually trying to get pregnant, or just optimizing our health in general. It's an important aspect of our health, as you mentioned, related to all this, all the other systems in our body. So I think that's really important as well. And I think you provided such a interesting conversation around the uterine microbiome, but also microbiomes in general, that I know our listeners are going to love. So I just want to say a massive thank you for coming on and sharing some of your extensive knowledge on this topic. Thank you, Inna.
Thank you very much.